Now, moving on to India, it has overtaken Russia as the third hardest hit country in the COVID-19 pandemic. Its total number of cases is now nearing 700,000 after a spike over the past few days. India is now behind only Brazil and the United States in the total number of recorded cases. Maharashtra remains the worst affected state with more than 200,000 cases. Its capital of Mumbai, along with Delhi, Chennai and Ahmedabad, are among the worst affected cities. For more, let's cross over to speak to Ishan Garg. Ishan, the Indian government seems to have shifted the responsibility to its citizens to live with the virus and to safeguard themselves against the virus. Tell us more.
Yes, that is correct. We have seen a number of statements coming not only from state leaders but also from the Minister of Health of India and the Prime Minister Narendra Modi as well, essentially calling for all Indians to learn to live with the virus. Now, they do add that people need to take necessary precautions, such as people should not get out of their houses unless it's absolutely necessary, maintain social distancing and put on a mask every single time they're out in public. But at the same time, the responsibility to fend themselves from the virus has been passed on to people, and this is just one part of the story. The second part is that there is no broader federal policy to control the pandemic. There is no broader federal policy to actually tackle the growth in the cases that we have been seeing for the past 5 days. India registering record number of cases every single day. That responsibility has now been passed on to state governments and local city municipal authorities, and because of that we are seeing a number of cities, a number of larger municipal corporations like the ones in Delhi, Mumbai or Bangalore in down south. We are seeing that they are locking down the city by themselves without there being a federal directive. So we are seeing that the federal government intends to reopen the country even further, and the idea, it says, is to get the Indian economy back on track. But experts say that the cost of human life could be way worse than the economic cost of the pandemic.
Ishan, we hear that the Indian government is planning to address the price gap in coronavirus testing in the country. Do we know what they're intending to do?
Well, the pricing of coronavirus tests hugely differs in some states from the others, and a major reason for that is the pricing from the private players is not fixed. So in some states you could see the same test being conducted for $70 or $80 per test, and in other states where the state government have intervened, the test could there be for about $30, or in the state of New Delhi we could even get it for $22, while in other states you could get it for much higher than that. Now, the Indian government is intervening here, saying that they want to put a cap on the pricing of the test, and they hope that people who go through the private treatment route when they get infected with COVID-19 will be able to get the treatment cheaper. But experts say that at this point, the government should not stop here. They should go ahead with more interventions, because in the past 2 to 3 months, what we have seen is that people who go through the private route for their treatment of COVID-19, they come out with thousands of dollars of medical bills. And if they go on to use the ICU care units, the bills could be even higher. So there is a growing call among people to ask the government that they must intervene and set a price tag on at least the essential components of COVID-19 treatment. Testing is one part of that. Plasma therapy could be another, and the usage of ICU centers or ICU units could be the next one from there.
All right, thanks for that. Ishan Garg speaking to us from New Delhi on India's COVID-19 situation.